The best artists, innovators, and creators know you can't rush quality. It takes time. Quality doesn't come overnight, from a fluke or from a split-second encounter. It takes trial, effort, craft, and precision. It never comes from your first question, your first answer, thought, or idea. It takes longer, days, months, even years. Quality is never finished from the first stroke. You have to look, touch, feel, mold, and reshape to find that inspiration to reach the extraordinary. Over 20 years of inspiration, we have been perfecting every breakthrough, putting our knowledge, skills, and expertise into our work to become the best in the aesthetic industry. With our German engineering pedigree, our years of experience in hyaluronic acid products and patented technologies, we will continue to invest our time to push the quality of our products, because quality of craft means impeccable beauty. Bioscience, the beauty of quality. The best artists, innovators, and creators know you can't rush quality. It takes time. Quality doesn't come overnight or from a split-second encounter. It takes trial, effort, craft, and precision. It never comes from your first question, your first answer, thought, or idea. It takes longer, days, months, even years. Quality is never finished from the first stroke. You have to look, touch, feel, mold, and reshape to find that inspiration to reach the extraordinary. And from over 20 years of inspiration, we have been perfecting every breakthrough, putting our knowledge, skills, and expertise into our work to become the best in the aesthetic industry. With our German engineering pedigree, our years of experience in hyaluronic acid products and patented technologies, we will continue to invest our time to push the quality of our products, because quality of craft means impeccable beauty. Science, the beauty of quality. The best artists, innovators, and creators know you can't rush quality. It takes time. Quality doesn't come overnight, from a fluke or from a split-second encounter. It takes trial, effort, craft, and precision. It never comes from your first question, your first answer, thought, or idea. It takes longer, days, months, even years. Quality is never finished from the first stroke. You have to look, touch, feel, mold, and reshape to find that inspiration to reach the extraordinary. And from over 20 years of inspiration, we have been perfecting every breakthrough, putting our knowledge, skills, and expertise into our work to become the best in the aesthetic industry. With our German engineering pedigree, our years of experience in hyaluronic acid products and patented technologies, we will continue to invest our time to push the quality of our products, because quality of craft means impeccable beauty. Bioscience, the beauty of quality. The best artists, innovators, and creators know you can't rush quality. It takes time. Quality doesn't come overnight, from a fluke, or from a split-second encounter. It takes trial, effort, craft, and precision. It never comes from your first question, your first answer, thought, or idea. It takes longer, days, months, even years. Quality is never finished from the first stroke. You have to look, touch, feel, mold, and reshape to find that inspiration, to reach the extraordinary. And from over 20 years of inspiration, we have been perfecting every breakthrough, putting our knowledge, skills, and expertise into our work to become the best in the aesthetic industry. With our German engineering pedigree, our years of experience in hyaluronic acid products and patented technologies, we will continue to invest our time in the quality of our products, because quality of craft means impeccable beauty. Bioscience, the beauty of quality. The best artists, innovators, and creators know you can't rush quality. It takes time. Quality doesn't come overnight, fluke, or from a split-second encounter. It takes trial, effort, craft, and precision. It never comes from your first question, your first answer, thought, or idea. It takes longer, days, months, even years. Quality is never finished from the first stroke. You have to look, touch, feel, mold, and reshape to find that inspiration, to reach the extraordinary. And from over 20 years of inspiration, we have been perfecting every breakthrough, putting our knowledge, skills, and expertise into our work to become the best in the aesthetic industry. With our German engineering pedigree, our years of experience in hyaluronic acid products and patented technologies, we will continue to invest our time to push the quality of our products, because quality of craft means impeccable beauty. Bioscience, the beauty of quality.
Welcome everyone. My name is Teresa Galera and I am the Medical Affairs Manager at Bioscience. Thank you for joining us today to this exciting webinar in which we will talk about safety of body fillers. Bioscience dermal fillers has strict quality controls to hold the CE mark. In addition to this, every single batch is tested before being released. With more than 15 years in the market, presence in more than 70 countries, and no recalls, we may say that one of the values of bioscience. At this moment, we are working on registering the products in USA, Brazil, and Russia. I want to share with you now the agenda that we are going to follow today. Body contouring with hyaluronic acid fillers is a non-surgical procedure. However, there is no procedure with zero risk and side effects may happen. As important as how to conduct the procedure itself is how to face these situations. So today, we will start with Dr. Brambilla that will show us what side effects could occur and how to handle them. Second, we will move to Dr. Cortiñas that will explain good practices in order to prevent adverse reactions to happen. And finally, Dr. Carballo will present a couple of real cases in which we will have the opportunity to learn all the steps that she successfully performed. Last but not least, we will have a round of questions and answers that will be answered by our doctors. In the platform, you will find two different buttons, questions and answer and the chat. Please type the questions in the questions and answer button. This way, after the webinar, you will receive the answer to your questions in your email. You can also subscribe to our newsletter to be the first to know when we release the answer and webinar replay. So let's start today's session with Dr. Brambilla. Hello, Dr. Brambilla, welcome to this webinar.
Hi, good evening. Good evening, everybody. So let's share the screen. And first of all, thanks for the invitation, for the opportunity to share with you our experience with all that. So Teresa, can you see the screen? The screen is shared. Is it? Okay, so let's start. So first of all, as I told you, thanks for the invitation to share with you the experience on body fillers, and of course, why not talking about complications? There are no treatments that are without any complications. So we need to talk about that in order to stay safe. Reshaping body contouring with injectables gained lots of popularity in the last years. And for us plastic surgeons, of course, fat graft is by far still the golden standard in most of the cases we treat. But there are some options where and when fat graft cannot be used because of local conditions or because of the will of the patients. So we are talking about synthetic body fillers, synthesis body fillers that may be divided into permanent and partially absorbable or absorbable. And today we will talk about hyaluronic acid, so products that are totally reabsorbable. We have to care about the fact that we know that the HA can in two main groups. There are body fillers, HA for body contouring, that has been not specifically designed for body contouring, and there are others that have been specifically designed for body contouring. And this is a great benefit for us because using products that has a specific indication give us a practical, scientific, and then, of course, a legal benefit, because if something happened, we are supported by the fact that the indication was body filler, and we cannot forget that. What makes the difference between one hyaluronic acid and the other is rheology, and rheology is the physical characteristic influencing the behavior of HA when is subject to deformities forces. So viscosity, elasticity, and cohesivity are the main characteristic and are built up on the HA concentration, on the HA molecular weight, and the cross-linking. And each product has specific indications and specific characteristics. And if we have a look, for example, at the portfolio of Bioscience, there are at least 3 products that may be used for body contouring, and each one a specific characteristic of viscosity and elasticity. It means that we may use all of them for body contouring, but some are more indicated in some places and some in the others. And all that is a great benefit when we have to use, because, for example, in this case, we may use some HiaCorp 1 or 2, depending on the depth of injection and the kind of indication and the type of injection, such as bolus or fan technique. And if we have to stay even more superficial, I may use a product that has a less cohesivity, for example, a Genefic Contour. Of course, when we treat a patient with any device or any injectable complications. So talking about HA, we have complications that are due to wrong indications, such as inappropriate indication and an appropriate product, or appropriate product but inappropriate indications, and then early complications that may occur, the catastrophe of embolism, the hematoma, infection, pain, hardness, itching, and the wrong placement, the midterm complications such as wrong placement or displacement and non-uniform distribution, and the granulomas, extra rare, but they may occur, the lumps and nodules. And then finally, the late complications that generally are due to non-uniform reabsorption or extra early reabsorption. And an unhappy patient, for me, it's a complication. Wrong indications, as I told you, inappropriate indication or inappropriate product, or appropriate product but inappropriate indication. One of the classic overall is breast augmentation. Breast augmentation cannot be performed, has not to be performed with HA. I think personally that one day injectables will be an alternative to breast implants, but we have to wait for studies about the safety, not only the efficacy. So those studies, there are no studies about that right now. So we cannot use these products for breast augmentation, of course. So this is a case that was referred to me. She underwent a breast augmentation with hyaluronic acid. You see inferiorly the image of the capsules and the HA that was aspirated, easily aspirated. And then I performed a breast augmentation, a submuscular dual plane breast augmentation with no problems. But this is definitely a wrong indication. It's not the wrong product, but it's wrong indication. Then early complication, by far the most terrorizing one is embolism. Of course, we know that SINCERES and SINCERES, ISOPS, as well as many other societies are talking about safety and efficacy of fat graft in the gluteal area. I will not stay too much on that because the literature now is plentiful of very good level papers in which is pointed out where to inject, where not to inject, which are the points where we have not to go and where we can go. But I want to highlight one paper that for me is very interesting about injections. The paper of Tanstatit published in 2017, in which the title is very clear, The Dark Side of a Cannula Injection, and they made a very good paper about how the cannula may inject inside the vessels. And according to their experience, they divided into zones that are safe and zones that are not safe. And then at the end, what they suggest is how to stay safe at the submission injection, superior injection, the use of cannulas of 3-4 millimeters. I understand that injecting HA with a big cannula is something that for some doctors, especially aesthetic doctors, is quite scary. But from the other side, it's safety. So if we're talking about safety, let's stay on the safe side. And then the retrograde injection and the fan technique injection. So those are all suggestions to stay safe. If you're not comfortable with anatomy, I really think that the use of ultrasound is crucial and can be a great help because we know exactly where we're injecting and staying far away from the muscles or in areas where we don't want to be. Changing the subject and talking about early complications, ecchymosis may happen. The diagnosis is clinical. You may be supported by ultrasound. I'm a beloved of ultrasound because for me it's something that gives a huge benefit to the clinical clinical aspect. So the treatment is quite easy. So the topical heparinoids and cold packs, and the problem will be solved. Different is the case of hematoma, because with hematoma, diagnosis clinical and ultrasound based. And if an hematoma occurs and there is, for example, a leak, and you can detect it, so you can enter with a 16 or 18 gauge needle, and under ultrasound, you may aspirate. Sometimes if the blood is mixed with hyaluronic acid, it might be difficult to aspirate. So some drops, some drops can be very useful to clear the hyaluronic acid. Itching, clinical diagnosis and ultrasound diagnosis if needed, but because it's generally inflammatory reactions, so NSAIDs or cold packs are fair enough. Sometimes oral antihistaminic may be helpful. Sometimes itching is generated by ecchymosis, so some heparinoid cream may help to solve the problem, but it's definitely temporary. More difficult is the chapter, the infection chapter, because the diagnosis sometimes is not easy. Sometimes we think about infection and is not. Sometimes we think about inflammation and is not. So if we think about an infection, ongoing infection, immediate broad spectrum antibiotic to be given, but at the same time, a microbiology investigation is needed. And after that, when we have the result, please get the opinion of an infectionist. Infectionists are nowadays very skilled. I work with some very good infectionists, and they give you all the answers you need, and also a medical legal protection. So it's not enough, a broad spectrum. We have to go directly on the bacterial that it's inside. How to prevent infection? Well, first of all, sterility. Stay on the ISAPS indication on how to perform a treatment, and you will stay safe. Antibiotic prophylaxis is mandatory with a cephalosporin or beta-lactamic antibiotic, intramuscular or IV with an IV administration. So this is up to you, but for me, the recommendation is the prophylaxis. Giving the antibiotic after the treatment, we know from the literature that is not enough to give a protection to infection. Then pain. This is another good chapter, because when we inject fat or we inject HA or whatsoever, we have pain. And the causes may be inflammatory reactions, or sometimes even intramuscular injection, or an hematoma, or an infection. So when there is pain, we have to talk with the patient. We have to be sure about the reason of the pain. So clinical, the clinical view is crucial, but ultrasound and in some cases even MRI can be of great support, enormous support. So for example, if there's an inflammatory reaction, NSAIDs and cold packs are okay, and for intramuscular injection as well. If an hematoma, we already talked about that, so aspiration if possible. If an infection, I already told about that, and an appropriate treatment is mandatory. Then again, for example, this one case that was referred to me, she had pain after cough injection, so she had some HA inside the gastrocnemius. It's just a matter of waiting a couple of days, sometimes a week, with some massage, and will resolve spontaneously. But we have to know about that. So again, investigations, instrumental investigation is crucial. How to prevent it? How to prevent pain? Well, we know from the pathophysiology of pain that if we don't allow the pain to rise up, the chronic pain drop down dramatically. So what I used to do is 30 minutes before the treatment, if the patients might have it, ketorolac 30 milligrams intramuscular or IV, and then for couple of days, for 4 days, 2 per day, some ibuprofen 400 milligrams to reduce the pain at the minimum. So if in the first days you reduce the pain to the minimum, then the pain will not rise up. Harness. Harness, this is another complication that may occur and may be due to inflammation, hematoma, or to an infection. In inflammation, and so it's called PAX. And if no results, HA has to be aspirated and reduced in quantity under ultrasound. And anyway, a microbiology test has to be performed in order to stay extra safe. Hematoma, aspiration, of course, infection, we already talked about that, so proper antibiotic treatment. Then sometimes there are some complications, such as early or mild-term complications, in early mild-term complications, such as the leaking from the entry points. The causes is intratunnel injection or too superficial injection, and the treatment is incision and squeezing. You see here one case very easily. You can punch it with a 10-gauge needle or with 11 blade, and then squeeze it, and then doing a compression, and you will solve easily the problem. Mid-long-term complication, displacement. The displacement may be due to ununiform or improper injection, but even from traumas, we have displacement of implants for traumas. We have displacement of injectables from traumas. So it may happen. Or ununiform reabsorption, and that can happen, for example, when there is an hematoma from one side, but there is no hematoma from the other side, the rate of reabsorption will be much higher on the hematoma side than on the other one. So we see that in middle long term, and HA removal or reshaping is the answer. So for example, this is a case of a traumatic displacement after 5 months of injection. And what I did here was aspiration with a 10-gauge needle, and injection on both trochanteric. So I decided to go on the reshaping, method instead of removing all the hyaluronic acid, determining I think a damage from the contouring point of view. Lumps and nodules, they may occur. And the causes of lumps is the generation of capsules around HA, and the diagnosis is, of course, clinical and, if needed, with ultrasound. But the nodules and the lumps are very easy to squeeze, very easy to squeeze. Sometimes it can be helpful to aspirate the hyaluronic acid with a 10-gauge needle entering under ultrasound inside the lump. In most of the cases, it's very easy to aspirate it after some months, but in some cases it may be difficult. So what I suggest is to inject some hyaluronidase inside the lump, waiting for a couple of minutes, 2, 3, 4 minutes, and then again, a 10-gauge needle and aspirating, and you will aspirate easily the material. I want to highlight that the capsule of HA is by very different from the capsule in breast implants, because there are multiple small capsules, and even from histological point of view, there are huge differences, because on the first one, silicone oil, or even capsule of breast implants, there is plenty of fibroblast histiocytes, and there is a rich vascularity. On the other side, HA, the capsules of HA are very poor fibroblasts, so they are not tough, few histiocytes, and there is very low vascularity. So the lumps are very easy to squeeze, and then imagine that from one big lump you squeeze it and you will get some other small lumps. One of the mistakes that can be made is to squeeze too much and then you spread too much of the product around. So you have to be quite gentle and being sure that you're squeezing exactly the lump that you want to squeeze. And not overpressing, not to distribute the product in spaces where you want to distribute. For example, this lump after 4 months in a scar that was treated with hyaluronic acid, and the colleague sent me the images of before and after, and she was afraid about the lump, but it was just a matter of squeezing, and it will solve the problem very, very easily. You see here the image of the lump that was squeezed and lung naturally under the scar. And this is another case that was referred to me with a lump before the squeezing, and then the lump that was fixed after the squeezing. So lumps are not a major problem. Those are major problems, I think. So Dr. Purbhaibat has a huge experience in hyaluronic acid. Send me those images that were referred to him. And those are, for me, anyway, quite scary because they are difficult to treat and to interpret and to understand. What you have to do in those cases, first of all, is the diagnosis. We have to think about the causes. The causes may be low aggressivity infections. Sometimes we have bacteria that are not able to give a proper infection, as well as those bacteria that we may found on the capsules. So low aggressivity, but they are there, and sometimes they give sort of cellulitis. Or they may be due to microcirculation changes because of trauma, or even because of excessive volume injection. And seromas, sometimes you may find some seromas, but the most scaring one, of course, is the autoimmune response. This is why the diagnosis is fundamental. The medical history, the previous treatments that the patients underwent, the intraoperative conditions where the treatment was performed. There are conditions that are perfect to perform any type of injection, and there are others that cannot be considered as safe conditions. Traumas, the type and volume of injected HA, and of course, the history of autoimmune diseases. When we don't know exactly what's going on, ultrasound and MRI may give a huge support, may be very important in order to identify exactly which is the problem. Microbiology, of course. So every time we have a case like that, microbiology is crucial as well. Sometimes biopsy, if we cannot solve the problem easily, we have to go on biopsy. So if the problem is a low aggressivity infection, antibiotic therapy, and of an infectionist specialist, giving the idea of which kind of antibiotic to use. If the problem is an excessive volume injection, aspiration. If the problem is seroma, of course, aspiration and fluid analysis. But then if the problem is an autoimmune response, we have to call for an immunologist to have an opinion. And nowadays there are therapies that work quite well on those kind of problems, such as monoclonal antibiotics and immunosuppression. But we are talking about very, very high level, and I really think that the cases are the cases needing for those kind of treatments are extra rare. So in conclusion, I think that we know that hyaluronic acid is on the market for body reshaping since many years, and the results that we may achieve are very interesting. And as I said when I started, HA may be one more arrow in our quiver for certain patients, not for everyone, but for certain patients. And of course, in some cases, we may go for such a treatments, for example, in patients where, for example, this is a patient of Poland syndrome, extra thin patients. We know that the use of implants, it's very difficult. There is no fat. Which are the other solutions? Latissimus dorsi, I won't do it on myself. So with hyaluronic acid, that was a temporary solution, but anyway, it was a solution. But despite all that, of course, we may have complications. So to reduce complication rate, a strict safety protocol of injection is crucial in order to reduce possible complications. And if any complications anyway occur, a proper treatment algorithm is mandatory. So I ended up my presentation, so feel free to send me any questions, and we'll be very happy, and I will appreciate your questions and very happy to answer.
Thank you very much, Dr. Brambilla. This has been a very interesting contribution on how to handle adverse reaction. If you have any question for the doctors, please type them in the questions and answer, and we will reply them during the questions and answer time. So next, I would like to introduce Dr. Cortiñas. He will talk us about prevention. Prevention is very important to minimize the probabilities of having adverse reaction and to increase patient safety. So thank you, Dr. Cortiñas, for joining us today, and you can start sharing your presentation.
Thank you, Teresa. Are you watching my screen? I'm sharing right now. Okay.
Yes, it's perfect.
Well, hello, everyone. Thank you for being there. With the background of our we are going to start to talk about something strictly related with patient safety. And as you know, and because I'm a member of the board of ISAPS, I have to emphasize that for our society, patient safety is a priority. And we show our commitment in patient safety through high quality education courses and congresses, and through an accreditation of surgical facilities in a joint with the IIISF. So we provide our members the best environment possible to give to their practices a patient safety. But let's focus a little bit in the word prevention. Prevention is a Latin word, and it means before, then from venire, to come, and tion, as an action. So prevention means an action that must be done before something comes. And having said that, let me focus a little bit in the injection process. The process of injection is not as many people think. The process of injection sometimes is watch like this. So it's a simple maneuver in which you just go under a dimple or a wrinkle and just add some filler, and the wrinkle or the dimple disappear. And this is not the case. In fact, when we are injecting in a tissue which is composed by a dense fibrous network with different components, densities, and resistance. And the filler may, but usually, follow the paths of less resistance. So every time we inject in a place like the subcutaneous tissue, we are going to have areas with more and less resistance, and the fillers will go to the less resistance area. And this is why sometimes we finally find the filler in a different place than the previous selected. After the injection, the process will start an alien body reaction, and this is a completely normal, with an immune system activation, with an immediate inflammatory response. And after a while, the filler will be like any other local tissue component, as in this microphotograph, in which we can see lymphocytic perivascular infiltration, and also some small lobules, some small droplets of silicone. And the silicone looks like fat cells. So it is integrated in the with the rest of the tissue components. So if you're doing this, what can go wrong? Okay, we may have problems with the technique. We may have problems with the tissue reaction to the filler, or we may have problems with the product selection. In one of the best papers I ever read about complications of injectable fillers, Claudio De Lorenzi published in 2013 in the Aesthetic Surgery Journal about technical complications. And he said that volume could be one technical complication, depth, and location. The volume can be injected in excess or in deficit. Injecting in deficit is much easier to correct than an injection in excess. The location could be a wrong placement because we choose the wrong anatomic site. Dr. Maximiliano was explaining about the precision of the injection. And when we are injecting in the wrong site, we are going to get the wrong response from the tissues. And we can get asymmetries. And the depth, because if you are injecting too superficial, we may have irregularities or bumps. But if you inject it too deep, we are going to need a lot of product to create some superficial effect. If you are thinking about the tissue reaction, we have immediate and late responses. The immediate responses are almost normal. I couldn't say that redness is a complication after an filler injection because it's quite normal to see redness. May have some swelling, may have ecchymosis because we can heat a vessel and get some bleeding. But if you have nodules in the immediate post-op injection, this could be for two reasons. One is because we hit a vessel and we got the small hematoma there. And the second is because we left there a lot of products, like a lake. LA infection, of course, it's very rare. It's not common at all. So speaking about nodules, let me try to move to one side because I can't see what I'm watching. Okay, and the late complications are the worst. The worst because it usually they present the complication after several years, months, and sometimes decades after the injection. And nodules are very hard to treat too, because they are non-inflammatory or inflammatory. If the patients develop a granuloma, which means a chronic inflammation, or infection, late infections usually due to another practice, is usually due to some immunological changes in the patient, or related to a biofilm. And the so-called ACS syndrome could be another delayed complication of fillers. What about the product selection? For me, this is crucial. Silicone We are lucky there is not longer in the market, but it creates migration, siliconomas, late inflammatory reaction. Watch this mammogram with the parenchyma, the breast parenchyma invisible because the droplets of silicone, and necrosis. This patient after 16 years of silicone injection in the breast with complete necrosis of the breast and the skin. There is another product, polymethyl methacrylate, in the market. It includes microspheres in the content, and microspheres will be integrated to the tissue immediately, and the so-called permanent effect. When I see a product with permanent effect, I see also some permanent choices of complications, so as late granulomas, lumps, that if it happens, require surgical treatment and probably disfigurement or serious scars. Polylactic acid is another one, powder of crystalloid particles. The main quality of this product is that when you inject it, you are going to have a potent, a very powerful biostimulation. But once again, a quite high index of fibrotic and inflammatory granulomas, lumps, and nodes. And the polyacrylic acid, this gel have been using in China and in Eastern Europe for breast augmentation with catastrophic consequences. So let's talk about the gold standard in injectables, which is the hyaluronic acid, which is a very simple molecule. It's present in all animal species. It's a lubricated agent. One of the qualities, it can be normally dissolved by hydroxylation and hyaluronidase. So the manufacturers needs to cross-link the molecule between them, creating chains, and those chains, after cross-linking, provide some cohesivity and some resistance to change and a higher G prime. So hyaluronic acid is normally well tolerated, creates water bonding after injection, so it helps to soften the product, has the lowest incidence of granulomas and late reaction, and can be removed with hyaluronidase. Here on the right, we have a video in which we applied some drop of hyaluronidase over a drop of hyaluronic acid, and you can see how easily it dissolves. And with after injection, with massage, we can spread the material and helps the tissue to absorb. So in terms of prevention, the first things we're going to do in our consultation is get an informed consent with an overall explanation about the procedure that must be present. Then, in the same informed consent, the possible complication must be described. We have to make a questionnaire to the patients asking about history of allergic reaction, history of previous injection, dates and products, because it's very common. It's very often that patients that come to our offices for an injection have had previous injection in the past, and sometimes many years ago, and they don't really know which kind of product the doctor used. And we can cause cross-reaction if you are injecting another filler into a permanent pre-existing one. History of medications just to avoid bruises and hematomas. Then we are going to start with the skin preparation. We need the cleanest patient as possible. So I ask patients to shower with antiseptic soap before the appointment and wear clean cotton clothes. Usually, female patients used to apply some body lotions or creams in the body, and this must be avoided. And of course, perfume perfume in an alcohol-based can be used. Depilation also should be avoided before the process of injection. In the office or in the operating room, we are going to make a skin cleansing, wiping thoroughly the area with chlorhexidine solution. Alcohol chlorhexidine is a little better, but chlorhexidine solution between 2 to 4%, it's okay. And use a sterile surgical field with surgical gloves and antibiotic prophylaxis before the injection. The technique must be accurate. We need an accurate diagnosis and select an appropriate plan, injecting the right and desired anatomical site. And aspirate before injection is not fully effective, but is advisable. About the technique, also, we must inject in small volumes at a time, gently. This is one way to pay attention to the patient reaction and see if you are injecting in some specific place that trigger a different reaction in the patient. So we can address quietly, never in a hurry, taking time, and remember that we can add more filler if we need it, but we cannot remove, or removing is sometimes impossible. After post-injection, stay tuned. Don't leave the patient aside. Be in contact with your patient and pay attention to their observations and worries. Remember that time, especially in vascular compromise, is gold in the treatment of any complication, but especially in those intravascular injection. So stay tuned and pay attention to your patients closely immediately after the injection. And thank you, ISAPS. Thank you, Bioscience. And I hope to see you all in Istanbul in September for our World Congress. Thank you very much, Teresa.
Thank you very much, Dr. Cortiñas. I think that you have done a very thorough review of all the parameters that have to be considered for prevention and for avoiding having adverse reaction. So now we will move with Doctora Sofia Carballo, and she will explain some real cases in which we can apply these tools in order to have success with the patients. So, Doctora Carballo, welcome to our webinar.
Hello, good afternoon to all of you, our esteemed colleagues. I will show the presentation. Let's see. So, as the colleagues showed before, the safety is the most important thing in a gluteal augmentation. As we know, buttocks augmentation is one of the fastest growing aesthetic procedures in the United States and Europe. From 2002 to 2015, the gluteal augmentation with fat increased by 3,200%, and this popularity led a greater focus in the media. But the death rate is the highest compared with our other aesthetics procedure, and we are talking about 1 in 3,400. It's too high. It's the highest death rate for any aesthetic procedure. That's why the Multi-Society Task Force for Safety in Gluteal Fat Grafting, representing board-certified plastic surgeons around the world, released a practice advisory on January 2018. Additionally, the task force is conducting anatomic studies to develop scientific technical safety guidelines. And these guidelines, these recommendations are both for fat and both for hyaluronic acid. Hyaluronic acid must be injected into the subcutaneous tissue. or in the superficial fat layer. We have to avoid intramuscular injection. We have to review gluteal vascular anatomy, draw landmarks, and identify the gluteal pedicles to avoid injection into the veins or arteries. As you know, we have safe zones, the green zones, and the danger zones, the red zones. The other recommendations is position patient and place incision to create a path that will avoid deep muscle injection. If the stated goal requires large volumes, we do in stages. We have to use large cannulas and avoid mobile lower connections. Injection should be from superiorly, not infragluteal, and we have to avoid downward angulation of the cannula. The cannula should be in constant motion and avoid high pressure bolus injection. Maintain constant three-dimensional awareness of the cannula tip. And remembering the surface anatomy of the buttock, we know that we have to position our hyaluronic acid in the middle of the maximum projection of the buttock. We have to identify the breast, the gluteal sulcus, the intergluteal cleft, and as our colleague has explained, we have to identify the gluteal pedicles. As we know, they are in the medial part of the buttock. The arteries are always under the gluteus maximus and medius. So if we are in the subcutaneous plan, we are safe. It's the most important thing. As you know, there are characteristics of aesthetic pleasing buttocks, like a short infragluteal fold, supragluteal facet, V-shaped sacral triangle, and a mild lateral depression. But this depression, it's an old ideal. The new ideal, it's a fullness and a roundness in the hip dips. And the new waist depression is not the 0.70, but 0.65. We must understand that there are ethnic variations that you have to be kept in mind while evaluating the patient, and the approach should preserve and respect the specific ethnic considerations. Regarding the markings, I will show you two kinds of markings. The first one is the diamond marking, that we have 4 points, the A, B, C, D point that makes a diamond, and we inject in bolus and in vectors this region when we want to project the buttocks. But there are other kind of markings, obviously. For example, I use this one, the third marking, that we have 3/3 superior, central, and lower third, medial, and lateral third. And we inject a bolus in the central area where we find the maximum projection point. And we inject also in the upper third and in the lateral third. We must not inject in the sulcus, gluteal sulcus or fold. Preparing the treatment, we prepare by drawing our marks with the patient in a standing position. We take our pictures, identifying the areas to be augmented, clean the area with an antiseptic solution. After that, we make the anesthesia of the entry points. We must ensure that our cannula will reach the whole area to be treated, we need to understand that large volume of local anesthetics may change the shape of the defects. So we distribute more or less 40 cc's of a dilution of lidocaine in the subcutaneous plan. After that, we introduce the cannula in the subcutaneous plan, and we do the confirmation with the non-dominant end. I do a bolus in the maximum projection point, make constant pressure in the embolus. We can do bolus or vectors, and in the end, we can do a molding. As you see in this small video, we cannot do a downward angulation of the cannula, always in a horizontal plane, subcutaneous. And in the end, we can use or taping or a compressive garment, as you prefer. I prefer the compressive because I think it's easier to our patients, but you can use what you prefer. Now I will show you two clinical cases, one from a woman from African ethnicity and one for a Caucasian woman. The first one, a 27-year-old female, presented as you see in this image. We know that African ethnicities has a full projection, a fullness of the lateral area, a fullness of the upper area. So we have to respect these specific characteristics. I will show you again two sessions. In the first session, I marked the gluteal area in 3/3, and I insert the maximum projection point, a bolus, and after that, I distribute the acid in the lateral and upper area. I used 40 cc of tumescent solution. I used bolus and vectors. I introduced hyaluronic acid in subcutaneous plan and also in the superficial fascia, and I use antibiotic prophylaxis. I use it MLEF2. And here you will see the before, the immediately after. We still see some irregularities from the anesthesia, but after 1 week, this is the result. We still see some ecchymosis, but it's normal after 1 week. And after, I did a second session to fill the hip dips, because we have to remember African ethnicities have a large and a fullness of the lateral area. And as you see, the patient was very satisfied with the result. In the second case, a Caucasian 41-year-old lady wants to do an augmentation. I did my markings. I used 40 cc of tumescent solution, 100 cc MLEF2 in bolus and vectors, in the subcutaneous plan, antibiotic prophylaxis, MLEF2 also, and the result immediately after and 1 week after, with the roundness, a natural roundness of the gluteal area. So The secret of the HA augmentation is to be the subcutaneous plan. Identify the subcutaneous plan with the cannula and our dominant hand, confirm with the non-dominant hand, and when we feel we are safe in the subcutaneous plan, we start to inject. There's no complications in the subcutaneous plan. The complications that we found in gluteal augmentation, every complications, they found the fat in the muscle. So if we inject in the subcutaneous plan, we are safe always.
Thank you very much, Sofia, for sharing with us your experience. I think that this last message is very, very important, to not inject intramuscular, but inject always in the subcutaneous. So now I would like to open the questions to the audience. So please type all the questions that you have in the questions and answers section, and we will be replying them with our doctors. So please, Dr. Brambilla, Dr. Cortiñas, and Dr. Carballo, if you can open your camera. I think, Sofia, that you are still sharing your presentation.
Sorry. Sorry. It's okay.
So the first question that we have in the chat is that it will be helpful to say what is the average volume of hyaluronic acid per area that is correlated with increased complication. So what will be your advice regarding this topic? Dr. Brambilla, would you like to start?
Yeah, okay. So I think that each single case need a different answer. So we cannot say that 20 cc's, 30 cc's, or 80 cc's are too much. It depends on the extension of the area and on the kind of injection. I think that each time an average amount of 40, 60 cc's for an area around 20 square centimeters is quite reasonable. But then you have to consider the tissues. There are tissues that are hyperlax, so with hyperlaxity, or tissues that cannot are not proper to handle this kind of product, are not good for big volumes. And then there are others that are definitely more stiff and they can keep the tissue much better. I suggest always to, when you want to play with bigger volumes, to perform it in several sessions, because then you have more, you know better the patient, you know better the reaction of the patients. I know that it's a loss of time for some of us, but I think that it's definitely much safer to know the reaction of the patients, especially if we are playing with quite a large amount of volume compared to the volumes we use normally to handle and to use for the face or for other parts of the body.
Mm-hmm. Would you like, Dr. Cortiñas or Dr. Carballo, would you like to add something to this point?
Yes. Thank you, Teresa. What I want to say is, when we work with fillers, we have to change our scope from the surgical practice. Because huge changes, big changes, and very visible changes. When we start working with fillers, we have to look very small modifications. We can correct irregularities, we can fill areas, but not as well as with surgery. So the first thing is trying to show the patients and watch the patients in a different way, because fillers will provide perhaps an enhanced correction than surgery, but very smoothly, very gently, and soft. And secondly, I could say that less is better. So if you have to inject, try to inject as less as possible, because huge amount of fillers is like huge implants, breast implants. Bigger implants has more complications than small implants. And the same happened with any exchange body injected or surgically applied.
Considering this topic, I think that it's very important to manage patient expectation after the procedure, right? So you have to explain what are the main differences in this topic. Dr. Carballo, would you like to add anything?
I think for the persons that are starting with the HA gluteal augmentation, we should think in 50 cc's for each side, for area. If we start with the 50 cc's, we start to see how much, where can we arrive with the 50 cc's. And the next stage, we can put more 50 cc's. And we start to understand how to manage HA in the gluteal area. And we are safe this way, working this way.
Perfect. From Bioscience, we always say that the maximum volume that can be injected is 150 mg. This is also something that has to be considered. We have a second question from Dr. Margara. Hello, Dr. Margara. He is asking, what do you think about the delayed reaction, inflammation after 3 months from the injection? Will it be stimulated by LPG massage?
I think that every trauma may induce an inflammatory reaction, but this happens with hyaluronic acid or may happen with breast implants as well. I recommend to my patients to avoid for a couple of months, for example, saunas or high temperatures in order not to stimulate tissues around the HA. So I think that everything can happen in 1 month or in 3 months or in a year. But I have to tell you that the percentage is quite low. Of course, a trauma or an LPG, but it's a trauma or a heavy massage may stimulate around the HA and generate an inflammatory reaction. Yes, of course, it may happen, I think.
We have an additional question, Dr. Cortiñas, maybe you can take this one. They are mentioning that it's impossible to discern between injecting in the muscle or in the subcutaneous tissue without ultrasound guidance. What will be your advice regarding this?
I think it's almost right, not completely right, but it's almost right. It's very difficult to know if you are in the subcutaneous place, except you are very superficial. You can make a pinch test, you can try. Sometimes when you hit the muscle, you get a contraction, and this shows that you are going through the aponeurosis of the gluteus maximum. But to be completely safe and superficial, you have to make a pinch test and try to inject as superficial as possible, avoiding superficial injection, really, which is irregularities, bumps, and palpation.
Okay, great.
One word about the question before. I think that I agree completely with Massimiliano, but ice compresses, ice cold water works very well with hyaluronic acid edema and redness. So in the cases, it doesn't matter the time, is a patient present some kind of reaction in ice cold packs, it may help a lot.
Thank you. Sophia, would you like to? You are muted. Please open the microphone.
I think it's not so difficult to identify the subcutaneous plan because the consistency of the muscle, when we touch muscle and when we are in the subcutaneous plan or in the superficial fascia, we find the very different from the muscle. So it's a question of experience. We can start injecting small volumes to understand how we feel subcutaneous plan And with the experience, we can understand where we are in the gluteal area.
Great. We have an additional question for you, Sofia. Is how many milliliters of hyaluronic acid were injected in the last 2 cases? And also, maybe you can also answer to this question, how long the hyaluronic acid lasts if the patient does not do exercise after the procedure?
So the quantity of hyaluronic acid, the first patient, the African patient, I injected in the first session 100 cc per side. And 1 month after, I injected 50 cc per side in the hip dips. So the second, I injected 100 cc in the 1 single session.
Okay, and how long does this last in the patient if they don't do exercise?
We can arrive till 1.5 years, 2 years without exercise and without procedures in the buttocks like massage, lymphatic drainage. Without that, we can arrive till 2 years, almost 2 years.
Now we have a question regarding the menopause. How does this factor affect when we are doing the procedure? Is something that is contraindicated, or is something that the procedure can be done in a woman that has experienced menopause?
I don't think that menopause is a contraindication for any treatment unless there are specific conditions in the area we are treating, but generally from the medical point of view, I don't think that this is a main contraindication.
Okay, great. Can they sit after the procedure?
Who's answering?
You, Dr. Brambilla, that you have
the answer is, of course, yes, but carefully. You cannot ask them to stand up for a week. Of course, yes, but with careful. I mean, we know from the buttocks augmentation or even fat graft that, of course, the patients they can see. They don't have to squeeze the buttocks or where it's been injected. But generally, you know, Teresa, when we inject the buttocks, we are in the upper pole. We are not in the lower one. Unless we are on the crease and doing some small injections in the crease, and doesn't matter for me much.
Usually, when we inject or put some implants, we put above the ischial tuberosity. When we sit in the ischial tuberosity, but implants or HA are above this line. So we advise our patients not to sit for many hours. For example, I had a patient that make an augmentation with the HA, and after that goes to Greece in a flight. I not advise this kind of things, but they can sit, obviously.
Okay, that is great. Dr. Cortiñas, we have a question. Do you think that there are more inflammation with some patients since vaccines of COVID?
No, we are taking care of that. We ask patients about vaccination and makes the injection of hyaluronic acid 2 weeks apart.
And there may be some hypersensitivity after COVID or after vaccine with hyaluronic acid?
I don't have any, I didn't read any article about this in experience. We have been injecting, not in the buttock, but in the face since the pandemic, much more than before, and without reaction. So I don't expect any hypersensitivity or a specific reaction because of the vaccine. If we do the injection with a time gap in between.
Great. We have a question from Dr. Aoxa. She asked if we can combine products, MLF1 and MLF2, and if combining this product increase the reaction of any side effects. Who would like to answer this one?
I go. We may combine, but staying in different spaces, different places, different levels. And I don't think that may affect the side effects. It's just a plus, because if you're using different products with different viscosity and elasticity and you stay in different levels, you will decrease because you use the proper product in the proper level. It's like in the face. It's like in the face. You want to treat the zygomatic arch, or you want to treat the nasolabia. They're very close one to the other, but you use different products.
We have also a question from Dr. Stefanelli. He's asking, what are the main reasons and risk factors for chronic inflammation? Is this something that you have experienced?
I go with an idea. I'm not sure because there is nothing on literature, and as far as I know, there are no studies or publications. I think that then one of the main reasons may be low aggressivity bacterials that may be found into the gel. I mean, not in the gel, because gel is sterile, but when you inject it improperly, you may have some bacteria. It's the same problem we have with implants. Has been demonstrated so well from Adams so many years ago, the findings of bacteria on the implant and the capability of giving reactions to capsules. And I strongly believe that one of the main reasons is this. And the second one is that anyway, we are playing with bigger volumes, and if there is a diathesis and an immunogenic setting that is not normal but tend to be abnormal, there may be an abnormal reaction to something that is not normal, that is there. And that may happen. Those are the two main reasons, I think.
I think Dr. Cortiñas or Dr. Carballo, if you want to say something, because I think that this topic is very interesting.
I completely agree with Massimo. It may be because the biofilm, and it's a theory, the biofilm is not something completely proved, but probably maybe the biofilm. And the other thing is the agent. Is chronic exposure to an agent, chronic exposure of our immune system to a so-called irritant agent, which is present and it's a foreign body. Well, it's impossible or very difficult to deal with it.
Yeah.
I would like to share that I had only one complication of chronic inflammation. And the curiosity is that my patient had also a capsular contracture in the breast. So we can see that there is some immunogenic reaction from the body because the product has a perfect biointegration. If we have material more superficial with irregularities, in 1 week, the product is all product is biointegrated without any irregularity. So the problem should be biofilm or the immunogenic response of each patient.
Okay, great. And I think that we can close this questions and answers section with this question. So from your point of view, what is the most important aspect of aftercare advice? So Dr. Cortiñas, would you like to start with your take-home message for all the attendees?
Yes, as I said, the most important post-op measure is being in contact with the patient. You or your assistant needs to receive as fast as possible any claim question, address that question, and give the appropriate importance.
Perfect. Dr. Brambilla?
I think that more than post-op care is the pre-treatment that makes the real difference. So it is how to deal with the patient and how you select the patient and how you perform your procedure. If you expose your patient to high risk doing it in an appropriate way or not appropriate settings, you will increase dramatically the risks. And so I think that this is far more important than avoiding heat or avoiding traumas or sitting in the proper position. I think that we play 90% of our job before and during the procedure. And then, okay, there is 10% that is even by chance. I mean, medicine is not 100% safe, and there might be complications. But if we decrease the level, we have less chances.
Perfect. Good message. And Doctora Carballo?
I think the first and most important thing is clarify the expectations of our patients. This kind of treatment will not give the volumes they need, they want, for example, in big augmentations, high volumes. This is not the that we should use. So first of all, clarify everything. And the second thing, most important thing, is injecting in the subcutaneous plane, in the central area of the buttock. In the hip dips area, there's no problem. But in the central area of the buttock, we have to be in the subcutaneous plane.
So perfect conclusion for this webinar. So thank you everyone for being part of this session. I would also like to thank our experts, Dr. Brambilla, Dr. Cortiñas, and Dr. Carballo for being with us. Bioscience really appreciate your presence and your contribution to this webinar with such insightful information backed with your many years of expertise. This webinar, as we have been talking about through the chat, has been recorded and will be shared in our website together with the answer to all the questions that you have asked us. And you will receive through your emails, and also if you subscribe to our newsletter, you will receive before. Please follow Bioscience and HiaCorp on Instagram and Facebook to be the first to receive any updates. We hope you enjoyed today's session, and we will be keeping in touch with you for more educational events around the use of thermal fillers. Thank you everybody for your time, and have a great rest of the day.
Thank you very much. Bye-bye.
Thank you.
Bye, Teresa. Bye-bye.
Bye, Fabian. Bye, Sofia. Ciao.
Ciao.